Hello, everyone. This is Dr. Andrew Campbell, and my presentation is going to be on molds, mycotoxins, and how they affect the brain in children and in adults. This is based on medical and scientific evidence. What does that mean? It means it's not from opinions. It's not from anecdotes and stories. It's not from Dr. Facebook or anything like that. It's from known and published medical studies and how these mycotoxins affect the brain. So let's get started. The first place we're going to go to is I'm going to give you a disclaimer. And second, I'm going to tell you what I do. Basically, I'm the editor-in-chief for 5 medical journals. I am also a medical advisor to MyMycoLab. And I don't get paid by them because I also teach at 2 medical schools, and these medical schools require that I not have any commercial dealings with, with a laboratory or something like that. So the 3 key rules in treating patients affected by toxins is this. 1, detect the cause of the disorder and the disease. 2, remove the person from the toxin or remove the toxin from the person. And 3, repair the damage. Having said that, that's the main points. Now we're going to get into the details. The big medical secret, I can tell you, is if you have the right diagnosis and then you start the right treatment, your patient is going to be cured. If you have the wrong diagnosis and you give the wrong treatment, then your patient is going to be sick continuously and not get well for years. Now, let's take a look at the brain. It's the only organ almost completely surrounded by bone, the skull. No other organ is. The heart isn't, the liver isn't, the kidneys aren't, etc. The brain weighs about 3 pounds, approximately, the adult brain, or about 2% of our body weight, but it uses 20 to 30% of the calories we consume. Anywhere from 1/4 to 1/3 of all calories we consume goes to our brain. And from the carotid arteries and the vertebral arteries, it receives the most fresh and oxygenated blood coming out of the heart through the aorta. The brain uses 20% of the oxygen absorbed by the lungs. The hourly blood flow through the brain, how much blood flows every hour through the brain? 13 gallons, or about 20% of all the blood pumped by the heart. There's over 400 miles of brain vessels, blood vessels in the brain. Mainly these are capillaries, because the brain has 100 billion neurons or brain cells, and each one of those cells has to receive oxygen and nutrients. 400 miles of blood vessels in our brain. Every person's thoughts, memories, emotions, actions, and reactions are in the brain. It is a fabulously complex organ, but it helps us tremendously too. Where do mycotoxins first go and affect the body? You're living or working in a place where there's mold. These are toxic, and they are producing spores, and these spores carry mycotoxins, and you breathe them in. So where do they first go to? They go to the brain. The overwhelming medical and scientific evidence shows that it is in the brain and nervous systems and tissues. Mycotoxin antibodies destroy brain cells by dysregulating mitochondria and causing cell death, what we call in medicine cell apoptosis. And they destroy the blood-brain barrier, allowing other things to flow into the brain. Now, what are the neurological effects? Autism spectrum disorder, learning disabilities, decrease in short and long-term memory in children and adults, optic neuritis, chronic inflammatory demyelinating polyneuropathy, known in neurology as CIDP, loss of balance, facial pain. It also is directly related to causing Alzheimer's, multiple sclerosis, Parkinson's disease, amyotrophic lateral sclerosis, which is also known as Lou Gehrig's disease, and movement disorders. That's how these affect us. I want to make two important points. A mold that produces mycotoxins produces a series of mycotoxins. It doesn't just produce one mycotoxin. The other side of that same coin, if a mold is known to produce mycotoxins and it's present in a home or building, then the mycotoxins it produces are present as well. They go together. And also, in considering this, a mycotoxin found can come from several mycotoxins. Now, let me give you size because this really matters. Hair, human hair, is 100 microns thick. Spores, those made by toxic molds, those are spores. Just like a plant makes seeds, molds make spores. They're about 3 to 4 microns thick. Hair is 100, these are 3 to 4. So when you breathe these spores in, they go to the deepest part of the brain, the lungs, and from the lungs, go right into the blood and then to the brain. And mycotoxins are 0.1 microns, the same size about as a COVID virus. So exposure to mycotoxins is by inhalation, dermal absorption through the skin. Ingestion is minimal because it's so tiny, and I'll get into that in a little bit. What are some of the frequent misdiagnoses? Fibromyalgia, chronic fatigue syndrome, chronic Lyme disease, depression, anxiety disorders, many times resistant to treatment, autoimmune diseases, POTS, dysautonomia, and demyelinating diseases. Now let's go for just a few moments on how mycotoxins affect neurodevelopment of children. In other words, how they affect the brain in kids and the development that they should normally have. Well, brain development is a complex process that begins a few days after conception and continues into young adulthood. The brain stops growing at about mid-20s, so 25 or so. So give your teenager a break. He still has some things to learn. A cascade of events which constitutes the process of brain development includes cell birth, which is we call neurogenesis, and gliogenesis, cell migration, cell differentiation, cell maturation, etc., and the formation of myelin. Myelin is what coats all our nerves. Brain development affects all areas in an infant's life, which includes language and communication, movement, social and emotional, and cognitive. What I mean by cognitive, I mean memory, planning, attention, and those things. Considering this, exposed fetuses through maternal exposure, infants and children's brains are highly vulnerable to mycotoxin toxicity. Why? Because they don't have the capacity to break down toxins, and their organs are still not fully functional and fully developed. And all of this can lead to what are known as neurodevelopmental disorders. Now, neurodevelopmental disorders in children include ADD, hyperactivity disorders, autism, learning disabilities, conduct disorders, cerebral palsy, impairment of vision and hearing, neurodevelopmental motor disorders, including tic disorders and specific learning disorders. Implicated in the increased risk of neurodevelopmental disorders such as autism especially, is the presence of mycotoxins. And in this video at the bottom, you can see everything, every journal, medical study that this comes from. Mycotoxins can easily cross the blood-brain barrier and reach the nerve cells, where they disrupt the function of the brain. And they exert their neurotoxic effects by affecting the neurological systems, changing the neurotransmitter systems and the neuronal activity, and inducing oxidative stress. They can also affect astrocytes and microglia that eventually lead to brain damage. So, for example, mycotoxins interfere with the synthesis and metabolism of serotonin. Well, this modify the metabolism of tryptophan and consequently decrease brain serotonin levels. And it can lead to an imbalance in acetylcholine and acetylcholinesterase in the brain. And what does that mean? It results in neurotransmission, affects how the nerves talk to each other and transmit information. And that can affect cognitive functions, memory, and learning. Here's a photograph of a young man. And this young man came to see me at age 5. He's totally autistic, ASD, and I treated him, I tested him for mycotoxins. He was highly positive. I treated him, and he's better. Here, he's going to school. He's a normal kid, completely normal. In this photograph, he came to tell me he was won as the champion of the school swim team. So in this picture, he's 12 years old. So 5, totally autistic, and now completely normal. This is another wonderful photograph. These are twins, and you can see them there when they were about 6 years old. A year prior to this picture on the left, they'd come to see me, and they were both autistic. Mom and Dad didn't know what to do and had heard me give a lecture, and so they came and brought me these 2 young boys. A year later, this picture was taken. They were fine. They were happy. They were admitted to school and going so forth. Now, here's the best part. The second picture is they came to visit me because they were just admitted into engineering school at the university. So you see, they went to autism to becoming engineers. And it's all was just treating mycotoxins. And I'm going to show you the treatment. Let's look at a couple of other neurotoxins here, T2 toxin and deoxynivalenol. It's also known as DON, D-O-N, 3 capital letters. T2 toxin changes the cellular structure and function in the brain, and deoxynivalenol disrupts the central nervous network, including neuroendocrine and growth hormone signaling. Notably, the contamination of molds and mycotoxins has been identified in the brains of Alzheimer's disease patients, and I'll show you that study. And deoxynivalenol can significantly affect the normal activities of the nervous system and the endocrine systems, and then cause damage to brain cells. For the last decade, T2 toxins have garnered considerable attention due to its neurotoxicity. It can cross the blood-brain barrier and accumulate in the brain and cause oxidative stress, mitochondrial dysfunction, and cause brain cellular damage. And how does that translate? Well, it translates into a mental confusion for these folks that have been and children that have been exposed to molds and mycotoxins. A common label is brain fog. Interestingly, this was a study published in 2009. It's years ago, and by Dr. Emting. Now, another study on same thing, T2 toxins, again, showing that it crosses the blood-brain barrier and accumulates in brain tissue. And human exposure to molds, mycotoxins, in water-damaged buildings can cause neurologic and neuropsychiatric signs and symptoms. Many of these clinical features can partly mimic or be similar to classic neurological disorders, including pain syndromes, movement disorders, delirium, dementia, and disorders of balance and coordination. We can see tremors, jerking movements, spastic dysphonia, tic-like motions, and idiopathic paroxysmal unique involuntary movements, such as chorea, hemibolism, and Parkinson's tremor, myoclonic jerks, etc. And imbalance and gait ataxia, walking, are seen much more commonly than pure cell findings in these patients. Balance relies on a lot of different inputs into the body: visual, proprioception, vestibular, and pyramidal motor system, etc. And so you lose those and you have difficulty in walking. Now, here's a study published by a group in Helsinki, Finland, led by Dr. Tamara Tuominen, a good friend. She's a lovely person, very, very intelligent. And she showed how chronic fatigue syndrome, fibromyalgia, hypersensitivities, such as allergies, food intolerance, sensitivity to chemicals, a concentration tolerable by most of the population, but to these patients, ultra-sensitive, sensitivity to electromagnetic fields, EMF, and even to daylight can be associated with mycotoxins. Some of the symptoms experienced by patients with advanced mold-related illness, such as fatigue, memory, and cognitive impairment, are like those reported by silicone breast implant patients. Yes, and we've treated many of that, and I've lectured on it, and there's in MyMycoLab's YouTube channel, there are videos I did for silicone breast implant victims. And in this study, they showed that neurological manifestations in patients with what is known as postural orthostatic tachycardia syndrome, POTS, myalgic encephalitis, chronic fatigue syndrome, chronic regional pain syndrome. These are all conditions that can be associated with advanced mold-related illness. In another study, the patients reported moderate to severe levels of cognitive, physical, and emotional symptoms, mostly depression. Well, here I show you on the left side the SPECT scan, single photon emission computerized tomography, SPECT scan of a healthy brain scan, and on the right of a toxic brain scan. Now, here's a study that I and several authors wrote, and it's titled Molds and Mycotoxins, Effects on the Neurological and Immune Systems in Humans. And it consisted of 119 patients, 79 females and 40 males. We used 20 controls that were normal. And we did nerve conduction velocities for motor nerves and sensory nerves. And there's the abnormal findings comprised of 3 groups. The biggest group was mixed both sensory and motor neuropathy, brain damage to the nerves. That was in 2/3. In 55, and 27, a little over a quarter of them, sensory nerve damage, and in 17, motor neuropathy, motor nerves. And what else did we find? High levels of anti-nuclear antibodies, ANA, and central nervous system myelin and peripheral nervous system myelin autoantibodies were found. And we concluded that molds and their associated mycotoxins and water-damaged buildings lead to multiple health problems involving the central nervous system and the immune system, in addition to pulmonary side effects and allergies. Exposure to these also initiates inflammatory processes. Now, here's one on multiple sclerosis, published by Dr. Brzezinski. And this is multiple sclerosis is one of the most frequent and severe demyelinating neurological diseases, mainly affecting young people, eventually leading them to become disabled and worsening and worsening and worsening. And this is a study from Rutgers University Medical School. We propose here that fungal toxins are the underlying cause of multiple sclerosis. So what is the study from Rutgers saying? Mycotoxins cause MS. And they've honed in on one in particular, and it was the mycotoxin gliotoxin in the blood serum that causes demyelination. And then in this other study, they said MS, multiple sclerosis resolution by antifungal therapy, compromises a strong evidence that supports fungi major contribution to this disease. Well, folks, here's another study. This is 42 patients who worked at a work site that had 20 years of water intrusion, chronic dampness, and mold growth. This is a study by Dr. Gary Ordog. And environmental testing confirmed the presence of airborne mold amplification in every room tested. Why? Because the AC was contaminated, the air conditioning system. So 42 of the employees complained of neurological deficits, including memory loss, cognitive dysfunction, dizziness, abnormalities of executive function, of thinking and doing and planning, headaches, visual disturbance, numbness and weakness of the extremities, arms and legs. Well, those patients had signs of memory loss, cognitive dysfunction, they had sensory and motor deficits, they had positive Romberg sign and ataxia. They also had positive MRI and PET scan findings consistent with areas of demyelination, loss of myelin, which we talked about. How about this study? Different brain regions are infected with fungi in Alzheimer's disease. So what they said, that the analysis of brain sections at autopsy of patients who died and had Alzheimer's disease revealed that all parts were infected with fungi, also the blood vessels. So, Parkinson's disease. Exposure to ochratoxin A may induce early Parkinson's disease and other neurodegenerative disorders. Here's another study on ALS, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. Now, in this study, they did again autopsies of the brain. And it states, our observations provide compelling evidence of fungal infection in all the patients' brains analyzed. Now, here's another one on amyotrophic lateral sclerosis. This is on the expression, and that there was a fungal association was confirmed. A treatment for this debilitating and fatal disease could be quite straightforward. And I can tell you it is. I've treated many ALS patients. What about this other study? 87 mycotoxins, no mycotoxin found. That's why. However, in urinary mycotoxin, 87 urinary mycotoxins, no singular mycotoxin or group of mycotoxins was associated with autism diagnosis in children. However, serum IgG and IgE levels are a more reliable index of long-term exposure, and that's MyMycoLab. So here you have this wonderful study that includes Dr. Theo Rodriguez, who I just spoke to the day before yesterday this past weekend at a conference called MAPS, and this is on children and on children with autism. Do you ever wonder why the CDC doesn't recognize urine mycotoxin tests as valid evidence? Have you ever thought about that? Well, neither the CDC or the FDA recognize urine mycotesting for three main reasons. Number one, it's not FDA approved. These labs are not validated through the FDA's standard process for diagnostic tests. Number two, exposure does not relate to disease. The CDC points out that almost everyone's exposed to low levels of mycotoxins through food, corn, wheat, peanuts, beans. So a positive result doesn't mean you're sick from it, because that's an excretion. It's what's left the body. Lack of standardization. Different labs use different cutoffs, methods, and interpretations. This means that two tests on the same person could give different results. That's not accurate, and that's not what you want to do to find out if you are affected by molds, toxic molds and mycotoxins. Their official warning: these tests can lead to misdiagnosis, unnecessary treatment, and anxiety. So folks, here's the CDC. Use of unvalidated urine mycotoxin tests. And this is AI Google. Urine test for mycotoxins measures levels of mold metabolites to assess potential exposure. It is important to note that the CDC and FDA do not endorse these tests for clinical diagnosis. In other words, urine testing should not be used for a diagnostic purpose. Blood serum antibody testing is considered more accurate for detecting mycotoxins exposure, as published studies have shown urine testing to be invalid. And here's a study that just came out in April 2025. This study highlights the challenges involved in modeling the relationship between urinary excretion of T2 toxin over time. We talked about how the T2 toxin destroys the blood-brain barrier, etc. These findings indicate that approximately 20% of the exposure can be traced back to urine within 24 hours, meaning that 80% of the time it's inaccurate. And here's a study, and it states several popular organic acid tests, OAT tests, claim to detect imbalances in gut bacteria and fungi. But most of the microbial markers on these tests do not measure what they claim to be. And again, that's another urine testing. That's why the FDA and the CDC complains. Here's a study published in the journal Toxins when they compared urine and blood serum testing of mycotoxins. They said the variability of mycotoxin and urine demands urine sampling at different times during the day, but they say because the urine testing uses creatinine concentration, various factors such as gender, whether you're male or female, age, diet, muscle mass, can influence the results. And what do they say about the testing used by MyMycoLab, the ELISA testing method? The ELISA testing method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. There it is, folks. And here is that study, MyMycoLab. Both IgG, indicating a toxic reaction, and IgE, mast cell activation measurement of 14 different mycotoxins. It's available internationally. And if you do the testing, you can have a complimentary Zoom call with Dr. Tessier, my associate, or myself, where we go over the test results. This is very important. Retest after 6 months of treatment. Treatment, folks. What is the treatment? Here we go. Treatment. Ready, everybody? Ready, everybody? First and foremost, the first rule of toxicology: get the patient away from the toxin or the toxin away from the patient. This is undoubtedly the most difficult part. I mean, you have patients who are in rental agreements that are difficult to break, need legal help and things like that. What if it's in your home and you own the home? Can you leave your home, or do you remediate, etc.? So this is the toughest part. So basically, once you get the patient away from the toxin or clean up the place from the toxin, get rid of it, then you start Itraconazole 100 milligrams twice a day with food for about 6 months. There's 8 specific supplements and vitamins at specific doses. Why do I say specific? Because in studies, they show that these help get rid of the mycotoxins. And you can get all of these at detoxpure.com. What is very helpful nutritionally is low histamine, anti-inflammatory nutritional plan. So let's look at some of the things recommended. Melatonin, only 3 milligrams. Why? Because recent study confirmed the benefits of melatonin in reducing cellular damage generated as a result of toxic agents such as mycotoxins. Okay? These protective effects are apparent when melatonin is given as a sole therapy or in conjunction with other potentially protective agents. And that's why it's 8 specific at specific doses. Melatonin's ability to protect neurons, nerve cells, from molecular damage due to a variety of substances, including mycotoxins. Let's take B complex. And for those of you who believe in the methylation myth and all that stuff, I have news for you, and I have another separate video that talks about the real research on that. The B vitamins comprise a group of 8 water-soluble vitamins. Their collective effects are particularly prevalent to numerous aspects of brain function, including energy production, DNA and RNA synthesis and repair, genomic and non-genomic methylation, and the synthesis of numerous neurochemicals and signaling molecules. Furthermore, evidence from human research clearly shows both that the significant proportion of the population of developed countries, like the United States, suffer from deficiencies or insufficiencies in one or more of this group of 8 soluble vitamins, and that, in the absence of an optimal diet, administration of the entire B group rather than small subsets at doses greatly in excess of the current government recommendations would be a rational approach to preserving brain health. Here's a lady, wife of a dentist. She has dementia on the left. October 24, I started treating her. Here she is, April 2025. She asked that her eyes not be blacked out because she said I was basically nothing in one and the other, I'm alive again. Let's look at another picture and talk about vitamin D supplementation, in particular vitamin D3. 43 autistic children were randomly put into 2 different groups. 22 received vitamin D3 and 21 did not. They received 15 weeks, okay? And they measured vitamin D3 level and inflammatory markers such as TNF-alpha and interleukin 37 were measured at the start and at the end of the study. This was published just last month in August 2025. After 15 weeks of vitamin D supplementation, serum vitamin D3 levels significantly increased while the inflammatory markers, TNF alpha and IL-36, significantly decreased. And the total real life rating scale score was significantly decreased in the intervention group. So this is just an example in autistic children of the effects of vitamin D3. As I said, this is before T2 toxins are able to cross the blood-brain barrier. Gliotoxin, remember we talked how gliotoxin causes multiple sclerosis? Well, the toxicity of gliotoxin increases when you give the patient glutathione. And we've all heard, especially me, I get all these emails every day, 7 days a week, about binders and glutathione cycles, Now, here's another important study. These results indicate that glutathione promotes gliotoxin-induced cytotoxicity. So no glutathione if you have mycotoxins. Let's look at fluconazole instead of itraconazole. Prophylactic fluconazole prevents candida. However, this drug has no activity against other molds. Itraconazole provides better protection against invasive mold infections. And here's a chart. Fluconazole, what is candida? Candida is a single cell mold. All the others, Aspergillus, Stachybotrys, Penicillium, Cladosporium, Fusarium, you name it, those are multicellular. They're unaffected by fluconazole, which is diflucan, versus itraconazole kills both single cell candida and all the others as well. Well, it's logical. So if you go to visit and have a consultation with Dr. Google, Dr. Facebook, it'll tell you, itraconazole affects these brain channels invented by that myth person who makes a lot of these mythical things such as brain channels. That's the Shoemaker crowd and Neil Nathan and all those people. Well, itraconazole, known as Sporanox, is a common antifungal that was developed in the late 1980s. Been used now for 30 years here. This was published in 22, so 3 more years. With an established safety records, multiple phase 2 clinical trials investigating itraconazole for even cancer, non-small cell lung cancer, prostate, basal cell carcinoma have been completing, showing an increase in the progression-free and overall survival. Cancer patients. Here's a patient. On the left side, 2 pictures of the forehead of this man, treated with itraconazole for 59 days. You see the difference? Look at that, 59 days. What about binders? Oh my gosh, these are so popular among that crowd, and cholestyramine and bile. Show me the studies. In medical school, I was taught one thing, and that one thing is, in God we trust. Everybody else has to show data. So I'm going to show data showing that binders is bunk. Animal studies in pigs, rabbits, sheep, broiler chickens, ducks, turkeys, rats, and mice show that binders work. However, there's no medical or scientific published studies to support their use in humans. So here's a study published on humans. They're effective only in aflatoxin. Well, aflatoxin doesn't grow indoors. There's studies that show that's an outdoor mycotoxin found in certain plants. They are ineffective in all other mycotoxins. In addition, they also bind vital vitamins as well as macro and microelements, zinc, magnesium, etc. Don't use binders. Oh, but it's found mycotoxins are in foods. Well, look at the last 3 lines of this side. An adult with a body weight of 170 pounds would have to eat 14 pounds of ready-to-eat oatmeal that's full of mold, or 20 slices of bread full of mold, or a 2-year-old child weighing about 30 pounds would have to eat 38 ounces of oatmeal or 3.5 slices of moldy bread to be affected. And I published a study with another doctor, Dr. Leonard Weinstock, showing how the gut destroys mycotoxins. It's a published study. Here's what a healthcare practitioner said. I have never had the desire to study treatment for mold because the treatment and testing out there from Shoemaker, etc., have never convinced me. In my 9 years of practice, I have never really seen a patient go through that style of treatment and come out of the other side feeling better. I have been watching your videos on YouTube and excited to get rolling treatment on a few patients with your paradigm. And I get patients who've been on this Shoemaker, Nathan thing for 2, 3, 4 years, and they're still sick. Now, here's from a clinician that gave a lecture at the American Academy of Anti-Aging Medicine in Las Vegas in December of 2024. And he came and listened to the lecture, and he said, Dr. Campbell, I am simply blown away with your knowledge base. After hearing you at this conference, I dove into your videos, and I wish I'd met you years ago after getting sucked into the Shoemaker-Nathan vortex. At least going forward with your direction, I will be able to truly help my complicated patients. Here's from a doctor. I'm a healthcare provider and have recently come across MyMycoLab's information. Thank you so much for the help you provide. I do really appreciate all of the great information on the website, especially the YouTube videos. Knowing that my own family has been exposed, we all just recently had our blood serum tested and are waiting on the results. As someone who has previously tried the holistic route, I can say for certain that it does not work. So those of you wanting to take the herbal and all that stuff, forget about it. It doesn't work. Now, folks, that's my email address if you have any questions. Here's some studies we published. The one I mentioned to you just a minute ago on molds, the brain, the gut, and misconceptions. This was with Dr. Weinstock. Here's another one with Dr. Watson. Molds, mycotoxin, the effects in children. Lyme disease and mycotoxins, how to tell the difference between the two, because a lot of Lyme is not Lyme, it's mycotoxins. And then lastly, the brain and mycotoxins that we just went through. And lastly, this study with Dr. Vajdani, Dr. Pollard, who's a professor at UCLA, and myself, environmental triggers and autoimmunity, autoimmune diseases. Folks, if you have any questions, I'm happy to answer them. Shoot me an email at immunedoctor@gmail.com. Thank you for participating and listening, and hope to see you in my next one, which will be soon again. Thank you all.